Talking about the relationship of the consumer, the provider, and the regulators as well. Obviously, there's been a bit of backlash between the NHS, the care homes. We saw that when there was all that talk about the numbers and not knowing what the numbers were in care homes, and the NHS putting patients into the care homes because they couldn't deal with the overflow. How do you think the government and regulators' relationship with care home providers will change?
I don't see it fundamentally changing. The NHS is this revered institution within the United Kingdom. It's largely seen that it can do no wrong. It doesn't operate in a true market. It is a monopoly provider. And yeah, my connections and experience with the NHS is that the NHS comes first and everybody else comes second. And I don't see that changing at all. I don't see Matt Hancock's rhetoric really delivering anything at all. It's very interesting that we had a short period where he wore a badge that said care on it as opposed to NHS, but that disappeared after a few weeks. Things could have been done for the staff to turn them into genuine key workers. But I know many care home staff who turned up to supermarkets in their work uniform, and because they don't have an NHS card, they are turned away and not allowed to go to the front of the queue, which is terribly, terribly unfair because they've been doing a shift, for 8, 10, 12 hours, just the same way that somebody in the NHS has been doing it. So I don't see that changing at all. The regulator, again, probably not either. I mean, obviously the regulator is not a genuine national regulator because they are by England, Scotland, Wales, Northern Ireland, etc., etc. But they have been pretty dormant during the period of the COVID crisis. I don't think CQC have really championed the sector in a way that they could have done, particularly around things like PPE prioritization. I heard many stories where, orders that had been placed with long-standing providers and suppliers into the care home sector were suddenly usurped because they had to go to the NHS. And then, the regulator gave the care home a black mark because they hadn't got enough PPE. It wasn't for want of trying, it was because the NHS had taken it all out of a supply chain. And really, I would have liked to have seen the regulator step up and be much more of a voice for the residents in care homes and really a bit more understanding. There's been issues, for example, around agency staff and not wanting agency staff to move between care facilities. Well, that's the nature of agency staff. They have a top up. So what do you end up? You end up then having to put agency staff on permanently. Well, that doesn't really make the situation any better. You also had the situation where, care home staff and care home residents have been told that they can get vaccinations and what have you. It's taken an awful long time for those to come, particularly with testing kits early on. A lot of the testing kits were very ad hoc and sporadic, yet the government talked about making care homes available for visitors. Well, the short answer is no, that didn't really happen. Again, the rhetoric and the reality were very, very far apart. And finally, I'd say on the regulator, I don't want to have a pop at the regulator, but I just don't think they've done a great job. We've had the situation where many of them have wanted to come into care homes, but have not come in being either vaccinated or tested to make sure that they are not super spreaders. And when they've come into care homes, largely it's been to mark down care homes rather than necessarily do an inspection and put them back to where they really justifiably ought to be. So it's very difficult situation at the moment.
I think partly the problem with the regulators is maybe they need people like yourself, commercial individuals who've been at the forefront and been involved in the operational aspect of it. Maybe that's part of the challenge, is that these guys haven't, obviously I don't know the portfolio and the background of these individuals, but maybe you should go into being one of these regulators so you could help provide some of that change.
Possible. I mean, I have had some conversations with them, but I unfortunately, I don't think they are particularly interested in people with a commercial background. If you look at the people who have been in the regulators, whichever one that might be, they tend not to be commercial people, which is a shame, really, because I think having a bit of diversity is absolutely critical. And working with the regulator is important. People like Professor Martin Green have spent years, decades, trying to work constructively with the regulator. I remember from my background having, provided consultation, for example, around the assessment process, the bandings, the gradings, and so on and so forth, and largely was ignored because there was already a view about it. I mean, just as an aside, if you take the 4 ratings in England, inadequate, requires improvement, satisfactory, and outstanding, you would normally expect that to be a normal distribution with as many one side of the middle as there are on the other side of the middle. But actually, when you look at it, I saw some data just recently. There was something like about 800 or so new care home ratings in the last month. Around about 2.5% were deemed to be outstanding, yet around about 10% were deemed to be inadequate. And such has this consistency been of a movement towards quite a negative approach towards regulation. And I think one of the things that, if I was in CQC's shoes, and it may be quite a controversial thing to say, is I think we need to reflect on the correlation between COVID and the regulatory banding. I mean, one would like to think that if you were in an outstanding home, that home, because of its nature of being outstanding, would be superior in every aspect, whether that be the facilities, the food, the accommodation, the staffing, but also the care and the infection control. That an outstanding home should be better than a not outstanding home in things like infection control. But actually, CQC's own analysis shows that there is no correlation between COVID suppression or COVID management and how good the home is in terms of being outstanding or otherwise.
How would COVID impact the purchase process of care homes?
Well, there's some very practical issues. I mean, the first one is you generally can't go and see what you're going to buy, which makes it difficult. And I know many people have adopted, virtual tours and that sort of thing. But normally you would want to go in and meet the manager, meet key members of staff, just get a feel for what's going on in the care home, and just sort of, that first impression. One of the things I always look at, you go in, does it smell? If it doesn't smell, that's a tick in the box for me. So practically, it's made it quite difficult to buy a care home in the way that you would previously do, and you are more and more reliant on the data room, which clearly is what it is, which is just data. In terms of the regulatory issues, I think it is difficult now to really get a sense of whether the home is good or bad. And obviously, COVID has knocked often people's occupancy down dramatically. 10% is not uncommon. In some cases, it could be 15%, maybe even 20%. And therefore, you are really relying on either on historical data to produce your run rate, or you've got to somehow accommodate what has been quite a drop in occupancy and possibly a real change to the bottom line. And again, I suppose that separates out those people who are maybe risk taking or more likely to risk take, and those people who have got an inherent sense of what is a good asset. People who've operated in the market for a long time will almost look at a care home and go, yeah, that I like that one. From those people who are maybe naive, or who are people who just driven entirely by spreadsheets. So it is a difficult one for people to do. And I think the COVID situation, I've heard a lot of people saying, oh, well, I'm going to wait until COVID's over. Right, okay, well, that could be 2 or 3 years before we get back to where we were before. Yet other people are saying, right, I can see some opportunities. I see particularly mum and pops, the owner managers have become disillusioned, fatigued. They maybe also feel that they don't want to be an operator when they're in their 60s or 70s anyway. Therefore, they're looking to exit. And people are now saying, great, that's an opportunity. We'll do a quick bit of due diligence, but actually we will make the process easy and simple and move on quickly, so that we can do something about it.
How will investors' due diligence change? What should they be looking at that they're not already? How would you be approaching this?
Well, I think you always have to look at the very traditional measures of, quality, and I would be looking at things like safeguarding, infection control, referrals, those sorts of things. Certainly around staffing, staff churn, numbers of issues around medication management, medication errors, those sorts of things. So I think there's a whole load of stuff around the quality of the operation, because without the quality underpinning it, you really haven't got a care home. That's why people come into care home, for quality care. You would also then be looking at all of the sort of KPIs around the cost base, around the building, the operation, and so on and so forth. But I would also now probably be, I wouldn't say things have changed, but I think the focus has maybe shifted a bit. I would be looking more critically at the layout and the orientation of the building. So I would be much more interested in facilities that were either purpose-built or purpose-built with sufficient space and elbow room to make them COVID compliant. So funnily enough, multi-floor services, which I would always normally not be so keen on, actually have some merits, because if you've got a multi-floor facility with, let's say, a day room on each one, you can then isolate the home, say it's got 3 floors, into 3 individual units, manage those individual units. If COVID breaks out, contain it within that particular floor without then having the impact on the entire home. It'd be those sorts of things. As I say, that's really just a bit of a shift in focus rather than something that I would bring in as being new because of COVID.
So if you enjoyed this content, please don't forget to like, share and subscribe for conversations just like this.